So in a nursing plan of care, there are usually 5 steps that are taking place to determine the best care for the patient. The first being assessment, where you collect, organize, validate, and document data. This can be from family background, friends, environment. The next step is diagnosis, which is where you identify the problem and any risk factors to create the framework for potential issues and needs that the patient may have. Next is planning, where you establish priorities and develop goals to create the desired outcome for the patient. And next, the fourth step being implementation, where you initiate interventions established during the planning phase to promote positive patient outcomes. And the final being evaluation, to determine if interventions are helping achieve expected outcomes. One important thing to note for evaluation is that even though it's the last step, this is something that you should be doing throughout the whole process, constantly evaluating and determining the best possible best next step forward. And since COVID-19 follows a typical 2-peak clinical course with 2 phases of symptoms, the first being the most commonly known fever, coughing, dyspnea, malaise, and fatigue. We'll be going over the second phase symptoms and the interventions you can do, along with the short-term goals, which is usually when patients are becoming critically ill with acute respiratory distress syndrome and or multi-organ dysfunction and require ICU admission.